Yeah, so obviously EV302 with EV and Pembro now being standard of care in first-line metastatic bladder cancer is a huge change for all of us that are used to giving patients chemotherapy. And as a urologist who sees a lot of these patients getting chemotherapy and doesn't necessarily administer it, I think it's a huge lift for our patients knowing that they have a really good option that has less toxicity and potentially can be curative, that was mentioned today, that may have really, really durable responses. Well, as a urologist, I love that they included the non-muscle invasive panel where Dr. Danishmand and Dr. Chang and Dr. Grievous got up there and talked about non-muscle invasive disease. As someone who's frequently participates in clinical trials, it was a terrific overview of what's happening, what's important. There's so much going on in non-muscle invasive bladder cancer, and I'm glad that they really spent some time talking about that. Yeah, it's really interesting. I think we're going to have a lot of alternatives to BCG. I think you're going to see that BCG is not necessarily the only thing that we use. Things like the pretzel, things that were mentioned, different agents that we put in the bladder, and then combination treatment. So I think it's going to be unlikely that we're just going to rely on BCG anymore. I think there's going to be a set of combination treatments for higher risk patients, and also a newer type of intravesical treatment in the bladder to potentially spare BCG in a lot of patients.